I saw a child who couldn't walk. Sit on a horse, laugh and talk. Then ride it through a field of daisies, and yet he could not walk unaided.
Thank you, Ladybug.
I saw a child, no legs below. Sit on a horse, make it go. Through the woods of green and places he had never been. To sit and stare, except from a chair. I saw a child who could only crawl, mount a horse and sit up tall, then put it through degrees of paces and laugh at the wonder in our faces. I saw a child born into strife, take up and hold the reins of life. And that same child was heard to say, "Thank God for showing me the way."
There are few words to describe the joy on a child's face when mounting and riding a horse. The bond between a child and a horse, or between an adult and a horse, is strong, and recognition of this bond has led to the development of a unique form of therapy called equine-assisted therapy. Hi, I'm Kelley Siegert, a Doctor of Physical Therapy student at Columbia University. The video you are about to see will introduce you to the foundations of equine-assisted therapy, various approaches, and benefits of each approach. My hope is that, with increased awareness of equine-assisted therapy and activities, that more people challenged with disabilities can take advantage of what these therapies have to offer. Equine-assisted therapy and activities includes a group of interventions intended for children and adults with physical and cognitive disabilities that utilize the horse to help achieve functional therapeutic goals. This unique form of therapy emerged in the United States in the 1960s, and at present, there are over 800 centers that offer some type of equine-assisted therapy or activities. Hippotherapy is a neurophysiologically based therapy utilizing the movement of the horse to accomplish therapeutic goals. It is named for the Greek word hippos, meaning horse. Therefore, hippotherapy literally means treatment with the help of a horse. The repetitive movement of the horse is used to influence the rider and facilitate preferred movement responses. Treatments are performed by licensed physical therapists, occupational therapists, or speech and language pathologists, and include activities that are meaningful to the patient and specifically address their individual functional goals. The patient learns to actively respond and accommodate to movement changes through automatic reactions and postural control. During treatment sessions, the therapist analyzes the patient's movement responses and modifies the horse's tempo, direction, and speed accordingly to meet the patient's individual needs. The objective is for riders to adapt their responses to the horse's movements, thereby facilitating improvements in sensory processing, balance reactions, and neuromuscular control. The three-dimensional movement of the horse is a powerful treatment medium. When a horse is walking, its pelvis moves in three motions: anterior-posterior pelvic tilt, lateral pelvic tilt, and pelvic rotation. These movements are similar to the three-dimensional movement of the human pelvis and provide central nervous system stimulation to the muscles involved in gait. When a rider sits astride a moving horse, their body is able to experience and respond to this movement as if they were walking on their own two legs.
Pull it down, two hands. Really, really big.
For a patient with a disability, this simulation of normal gait can greatly improve their skills in ambulation. The horse's rhythmical movement cannot be duplicated in any other type of clinical setting.
So you take the reins.
Hippotherapy has a positive influence on automatic balance reactions.
You're flying. She's flying.
By optimizing alignment and symmetry while on the horse, muscle tone is modified, placing the patient in a position of mechanical advantage to appropriately respond to movement changes. Therapists can utilize the movement of the horse through halt-walk transitions, which involve alternating between acceleration and deceleration, by changing directions, which involve centrifugal forces, or by changing the horse's tempo to help improve the patient's automatic balance reactions. The patient must adjust to these changes in an effort to keep his center of gravity above that of the horse. The patient learns to judge the speed and extent of his posture and movement responses, helping facilitate improvements in postural control. As riders increase their proximal strength, they are better able to gain strength and function in their distal extremities. The therapeutic effects of hippotherapy may be due to gradual changes in the brain that occur as a result of the horse's repetitive movement. A growing child's brain is constantly changing, and pathways that facilitate a certain movement become reinforced over time. When the brain is exposed to sensory information from normal movement experiences, it is better able to produce desirable movement patterns, giving rise to improvements in motor control. Hippotherapy may be beneficial for patients with musculoskeletal and neuromuscular conditions, including cerebral palsy, developmental delay, traumatic brain injury, cerebrovascular accident, muscular dystrophy, and multiple sclerosis.
Okay, sit tall, buddy.
The goal of hippotherapy is for improvements gained through movement activities while on the horse to carry over into functional activities while on land. Treatment sessions are directed towards normalizing muscle tone, increasing strength of trunk and extremity musculature, and facilitating normal balance reactions and movement patterns. Benefits of hippotherapy may include improvements in ambulation, postural control, sensory processing and integration, and a sense of confidence and well-being. Positive effects may also be demonstrated in speech, cognition, behavior, and social interaction.
Thank you, I love hugs.
Another type of equine-assisted therapy is equine-assisted psychotherapy. This specific type of therapy is designed for children and adults with psychosocial issues. These may include depression, anxiety, substance abuse, eating disorders, or behaviors following family bereavement or abuse. In this therapy, the horse serves as a catalyst for positive emotional interactions and can help promote a sense of well-being and improve quality of life. Yeah? What's your favorite thing to do on him? Do what?
Canter.
Canter? The bond between horse and human can provide a foundation for emotional growth and healing. Treatments may include interactive activities such as horse handling, grooming, or lunging, all of which promote critical thinking skills, problem solving, and teamwork. Equine-assisted psychotherapy is completed as a collaborative effort between a licensed therapist and a horse professional. The two therapies you've just seen fall under the category of equine-assisted therapy. It is important to differentiate between equine-assisted therapy and equine-assisted activities. Equine-assisted therapies are completed by a licensed therapist who utilizes the horse as a therapy tool to help accomplish therapeutic goals.
Okay, and you're going to curl your chin and sit all the way up. You need help? Oh, go, 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 go. Good one. Okay, ready? Let's do it again. Roll down.
Equine-assisted activities, on the other hand, are sport and recreational activities that have therapeutic value. These activities are completed by certified therapeutic riding or driving instructors. Equine-assisted activities include therapeutic riding and interactive vaulting. Therapeutic horseback riding is a recreational activity for children and adults with disabilities, which allows them to learn and practice horseback riding skills in a safe and controlled environment under the supervision of a certified therapeutic riding instructor.
Yeah, that's lovely. Right there. Remember to sit up tall even when you're doing that.
Directing a horse incorporates complex motor and cognitive skills, which help improve function in mobility, balance, proprioception, and bilateral activity. Therapeutic riding allows for development of meaningful relationships between the rider, horse, instructor, and other riders in the lesson.
Okay, walk on, let's go see, let's go look.
And may increase confidence and self-esteem.
In the feed shed.
You think of the feed shed? Do you know where that is?
Yes.
Asa, will you lead us out the gate? Let's go see if it's there. Walk on.
This therapy is appropriate for many conditions, including Down syndrome, attention deficit disorder, spina bifida, spinal cord injury, cognitive impairments, and developmental delay. Interactive vaulting involves the execution of gymnastic maneuvers on the moving horse. The rider performs movement changes into various challenging positions while the horse is walking, trotting, or at a canter. The combination of transitional movements and having to maintain unique positions on a dynamic moving surface challenges the rider's cognitive, perceptual, and motor planning skills. A primary goal of interactive vaulting is to increase social interaction, and sessions provide opportunity for communication and teamwork between riders.
There you go, that's standing.
Vaulting is an appropriate therapy for riders with developmental delay, attention deficit disorder, autism, Down syndrome, and hearing or sight impaired. As children grow, they are expected to achieve a series of developmental milestones that allow them to move about their environment, such as crawling, standing, and walking. For many children with disabilities, the acquisition of these skills is delayed. While on the horse, the therapist utilizes specific developmental positions that facilitate the acquisition of these important skills. In the forward sitting position, the patient may be challenged by alterations in the horse's movement, increasing activity in the abdominal and back musculature. Sitting astride the horse provides a passive stretch to many of the lower extremity muscles. Riding a horse provides an opportunity for proprioceptive input, giving the patient knowledge of where their body is in space. This input helps improve sitting posture and facilitates more desirable movement patterns. The backward sitting position is a unique challenge for the patient's vestibular system. The patient must be able to process the concept of sitting backwards on a horse that is concurrently moving forwards, facilitating a need to adjust balance mechanisms accordingly. Riding a horse in the prone position provides an opportunity to promote proprioceptive awareness and facilitation of active movement. Having the patient lift their head to look up facilitates muscle activity in their neck and back extensors and increases weight bearing through the upper extremities, allowing for scapular stabilization. This position also provides a passive stretch to the hamstrings and back extensors. Weight bearing on the spine is reduced, and the warmth from the horse's body allows for muscle relaxation. The supine position is a source of vestibular input, increasing proprioceptive sensation. Lying supine encourages elongation of the pectorals and other hypertonic muscles in the upper extremities, allowing for shoulder extension and scapular depression. It also facilitates midline stabilization and gentle mobilization of the cervical and thoracic spine. Resuming sitting from the supine position is a challenging activity for the patient and helps promote activity in their neck and trunk flexors.
Kick your leg around. Bring me your leg. Red Rover, sit.
Sitting sideways on the horse alters the direction of movement the patient is typically subjected to. In this position, the patient must adjust to lateral weight shifts. By having the horse walk in circles, the therapist challenges the patient to adjust to lateral as well as anterior-posterior forces simultaneously. This is a recommended exercise to increase strength in muscles required for core stabilization.
Okay, Carly, we're going to go into quad, or what we call puppy dog. So push up on your knees.
Assuming the quadruped position requires strength, coordination, and motor planning, as well as postural control to remain balanced on the moving horse. This position enhances proprioceptive input by creating significant weight-bearing pressure through the extremities and is a prerequisite skill for many developmental activities, such as crawling. The tall kneel position is a great challenge for balance. To maintain this position, the patient must use their hip extensor musculature to remain upright. From this position, the patient may assume a half kneel position. This requires good strength and coordination to accomplish and is a prerequisite skill for standing. Standing on the horse creates a significant challenge to balance. This position obligates the patient to respond to multiple balance challenges and process multidimensional sensory input. For the patient, standing on a horse can be an exciting and rewarding sensation. The therapist may engage the patient in many functionally based activities. Reaching for objects outside of their base of support helps the patient to increase their balance, as well as strengthen their upper extremity musculature. Reaching or passing objects across the midline of their body helps reinforce the association between the two hemispheres of the brain. Tossing a ball while on the horse promotes motor planning and anticipatory control and encourages symmetrical arm movement as well as trunk rotation to both sides. Coordination activities may assist with acquisition of both gross and fine motor skills. A cognitive element may be added to each of these activities, challenging the patient's dual attention skills.
Where's your eyes? Where's your tummy? All right, high five. Okay, your next trick is...
Activities included in a hippotherapy treatment must be individualized to the specific impairments, functional limitations, and goals of the patient.
You have 6 scoops of ice cream? Can you lick it? Pretend, look. Can you give little Red a lick? Oh, poor little Red. Okay, we'll put him away.
Another essential component is appropriate choice of horse. As each of us move differently, so too do horses. The therapist must choose a horse with suitable movement to encourage normalization of muscle tone. Patients with spasticity may benefit from a smooth, more rhythmical gait that will allow their muscles to relax. Patients with low muscle tone will benefit from a faster, more active gait that will engage their muscles. One of the most important components of hippotherapy is the bond between patient and horse. The horse can be a source of positive acceptance as well as an opportunity for play. This can lead to improvements in patient self-confidence, self-esteem, and functional performance. The importance of this bond cannot be understated in helping patients to achieve their fullest potential.
Thank you, Ladybug.
Probably my favorite story is the story of a young boy named Adam who, when he first came, had a little bit of trouble sitting up on his own and was not walking. He was in a wheelchair, and through a combination of things, he had some surgeries and then followed by physical therapy here on the horse. And so over the time, he's now able to walk on his own, and he's sitting up and actually riding independently, and he's probably one of my biggest success stories.
When Adam first came here, we were at a point in his life where we were told he would never get out of his wheelchair and we should just give up any idea that he would ever walk. And then one day after physical therapy, Tricia's physical therapist said, you know, I want to try something. And she's been practicing and balancing, not to my knowledge of what she was planning. She got him off his horse and he stood up and she let go of him and he stood and balanced. And then she asked him to lift his right leg and move it in front of him. And he did. And then he stood and balanced.
There's a couple reasons that I do this. As a child, I grew up and loved and had a passion for horses. I mean, that was my love. And then also, as I was growing up and deciding what to do in school, I knew that I wanted to help people. So combining a profession that helps people and being able to utilize my love of horses is just an amazing thing that I get to be able to do every day.
Pretty fun. I don't consider it as much work. It helps me have fun, and like it helps me stand up and it helps me like get stronger. I think it has done tremendous things. We have for Faith her self-esteem, and as I said, the biggest thing is she's been able now to basically start walking.
know, I have a passion for doing this. I believe that when I was young, I always wanted to work with people with disabilities, and I always loved horses. So I feel that God has given me the desires of my life to be here because I get to work with horses and I get to work with people with disabilities. So I feel like I'm in the perfect place, exactly where I'm supposed to be.
Thanks so much for watching this program. I hope the video has given you a little preview into the wonderful things that can happen from riding a horse.
This is a song I wrote myself about keeping your dreams big and not worrying about stuff that's gonna happen later. Here I stand at the starting line of the racetrack of my life. I had some bumps and turns and junk along the way, but I made it through. I will make it to the finish line. I promise you I will make it to the finish line. For if it takes me all my life, I will make it to the finish line. It's my hope, it's my dreams, and it's everything I need. I'll make it to the finish line.
Wow, dude. You wrote that? Yeah. Oh my God, that's amazing. Wow. Wow, dude, that was great.